Hello, my name is Reagan May. I'm from North Central Florida. I live in Gainesville. I'm currently working in a level 1 trauma hospital. So, we are a university hospital, and my unit is the transplant and acute nephrology. So, we work with pediatric and adult patients. And then my specialty would be an ECMO dialysis. Clinical experience with chronic conditions. So I've been a nurse since 2004, and mostly I work in a bedside unit. So I'm originally from the Philippines, and moved and worked in the Middle East for 3 years before coming here to the States in 2012. The the work experience I had was I was an emergency room nurse for 8 years, and I've dealt with pediatric and adult patients both in the Philippines and when I was in the Middle East. So we have those patients who have chronic conditions, simple as for pediatric, I would say asthma, and elderly patients would be multiple comorbidities that it's like from hypertension, diabetes, COPD, and I've been a triage nurse, so we triage patient accordingly. And then when I moved here to the States, my first work experience was in MICU and step down unit. So most of them are they have chronic conditions with comorbidities. My ideal practice setting after graduation is since I just finished my urgent care, my acute illness, I think that's where I fit in. Having it said that I work in the emergency room, and then I have those clinical judgment, I still have those like knowledge in how to deal with acute illnesses. And I would say that I enjoyed working in an urgent care, more of a family clinic. But I'm still a student. I'm still doing all these rotations. But the last rotation I had was in urgent care, where we have to learn how to suture. We have to work with emergency physicians, and then do like quick judgment on whether to do such management or whether to transfer the care to a hospital, since it was a freestanding ER. And I have two other friends who just graduated in NP, and I'm thinking I want to join the military to be a nurse practitioner, and I'm really, really like excited to finish this course and then to start working as a nurse practitioner after graduation, take the board, and then work in a clinic to gain experience, and then to apply in the military. And where I live, I have a good friend who's a recruitment officer, so he told me the requirements to apply for the job. And then the closest naval base is in Jacksonville, which is like an hour and a half drive from where I live. So my wife can stay here, and then I can work in Jacksonville, and then drive like an hour and a half, and then come back here and probably like in the future move there. And also, if given the chance as well, I want to stay in the hospital and then specialize more in renal patients and kidney patients. And that's it. Thank you. Bye bye.